evening, and thank you for joining us for this episode of Our View,
the show that explores topics from our seat in poverty and the way it shapes our world.
We are very lucky to have one of our founding members with us today, Jamie Bain. Jamie has been with us. You were one of the core members in the original group when we started meeting 17 years ago. Mm-hmm. I think one of my fondest memories of you, and it's funny because the topic of discussion today is the hidden cost of healthcare.
Right.
And one of my early memories of Jamie was my daughter, who was a teen mom, woke up in the middle of the night. The baby is running a fever. We didn't have any medicine on hand. And so I said, call Jamie Bain. And so she calls Jamie. And she's asking for Tylenol, or can she even give the baby Tylenol? And Jamie, in her nightgown, comes full speed running down the trailer park. I got Tylenol. so funny that we should be talking about that.
So Jamie is a mom of 3. She lives on a fixed income, and she has some serious. Her family members are battling some serious health issues, and Jamie has some serious health issues of her own. And some of those things that you have to face on a daily, underlying issues, are some things that folks wouldn't normally think about. So in this discussion, we want to kind of talk about, like, what are some of those barriers, even though you have health insurance, what are some of those other barriers that you meet every day that kind of battle with you a little bit?
Some of the daily struggles that I have had to deal with for several years is my husband was diagnosed with cancer when he was only 38. We had 3 very young children, including one that wasn't even in school yet. Mm-hmm. We had to live on $680 a month to survive. Yes, we did get food stamps. Yes, we got health care through the state. But still, have you ever tried to do a shoestring budget on $680 with 3 children under the age of 10, the youngest being maybe 4, and manage to provide everything they need, shoes, clothing, food?
Right.
And the reason behind you not being able to get, I mean, obviously Brett can't be employed with his condition.
He's permanently disabled.
But you couldn't go out and get a position either because of having to care for Brett.
Mm-hmm. Right.
But tell us again what the other reason is that you couldn't go out and get a job. Something about his medication.
Well, currently he has Medicare, but he also has Medicaid. And the only reason we're allowed to have Medicaid is because our income level is so low. We only live on about $1,500 a month. If I get a job and I make $300 before taxes, that kicks my husband off of the Medicaid, which pays 100% of his cancer medicine, which without that Medicaid is $32,898 a month.
A month.
A month. And because of his age, because he's not of retirement age, there's only 2 Medicare plans that he can choose from. Both of them, you have to spend over $5,000 the first month of the year before they start helping pay for any of his medication.
And currently, that's almost half of your annual income.
Oh, yeah. Yeah.
So what about, so you're on this limited income. Mm-hmm. How do you, Brett has to go to Ann Arbor. You were telling me she has to go to Ann Arbor. Mm-hmm. How do you do that? Like, you have to have the gas, you have to have the car?
We either have to depend on the insurance company to provide some kind of transportation, which we're thankful that it's there, but it's never a guarantee if they're going to be there on time or if they're going to pick me up or the type of driver we're going to get. Or yes, I have to drive him almost 45 minutes to an hour to go up there. And anytime we go up to Ann Arbor, we are looking at being up there at 8 a.m. and being there till 3, 4 o'clock in the afternoon.
So then there's meals that have to be provided for children and adults as well. And think about some of our members who don't even have transportation.
Right.
Like, what happens to them when something, because weren't you saying something to me this morning about having to call in advance for, because the rides are available?
Yeah, you have to give them 7 days notice.
Right, and like if you go to the doctor and the doctor says, Brett needs this CAT scan, well, now you've got to wait 7 days if you can't take him there to get him there because, well, wait, I have to coordinate the ride with when the CAT scan is going to be.
Or call an ambulance.
Right.
And if the insurance company doesn't feel that the ambulance ride was a necessary expense, I have to pay for it.
Wow.
Yeah.
Wow. And then just the care of Brett alone.
Yeah.
It's not like you can have someone come in and help.
No,
It's
not
just
really.
you.
No.
When he was first diagnosed, his back was technically broken. One of his vertebrae was eaten by the cancer, 80% the way. He was in a immobilizing back brace that looked like a turtle shell. He needed somebody to literally bathe him, dress him. He could not stand for any period of time, so he had to have somebody clean up after him, cook for him. And a lot of people say, well, that stuff you already are doing, isn't most of it, right? My husband was to the point where he couldn't even clean himself up after using the restroom. So he had to have somebody in there, and he used to cry, and he used to beg me, please, please don't bring a home health aide in. He was so embarrassed. He's such a proud man.
Well, and not to mention that your insurance wouldn't have paid for that, would it have?
Actually, no, unless I could prove that he needed it, which had to be prescribed by a doctor, which the doctors were more than willing to, but they told me there was going to be a 6-month waiting list for him to even get on for a home health aide. They told me, if you want to get paid for taking care of him, divorce him, and we'll pay
Yes.
you $20 an hour to take care of your husband.
Nice.
We've heard that quite a bit. Like in some of our senior population that we've talked with about this, one of our members in the industrial sewing crew, she was told that she couldn't take care of her son and be paid because, well, you're his mother, but we'll let you hire someone to come in and take care of him, but they can't be a family member, and they have to have this, this, and this in order to do it. A lot of folks don't want strangers to come into their home and take care of them. Plus, with the COVID that we just experienced, who really wants someone to come in that could possibly expose Brett to COVID when he's already got a weakened immune system? So now that makes it even worse. So yeah, it's not.
It's a struggle.
It is.
I
It is.
mean,
And I think it's about so much more than that, too, like over-the-counter medication.
Right.
not
Like, I go
covered.
to my doctor, and he says, well, you could just give Tylenol for this to the child. Or Tylenol is like $8 a bottle
Yeah.
now, I think, for
Yeah, it's
children's
expensive.
Tylenol. I don't know. I haven't bought that in a while because
It's
I have
expensive.
all my children are grown and I don't have to give them Tylenol anymore. They have their own. But it's like $8 a bottle now, I think. How do you afford that? Or, my grandkids had to get, had like an eczema or something and had to get this Eucerin lotion. It was pretty pricey. Like, I ended up
Right.
getting it for my daughter, but $15 a bottle for this stuff.
Right.
Like, that's crazy.
And the
to think that our families really, sometimes that equates to their food budget for the
Right.
week.
Yeah.
Like, my food budget's $25 and you want me to take 15 of it. In some places, in some doctor's offices, like, kudos to Day One, because I know that they'll try to help you. Like, for example, we were talking in our last episode about working class poor. So I work, my husband works, but we're just under like $55,000 a year combined income. We pay for our own insurance, but at the tune of $170 a paycheck out of my husband's paycheck. Then you add all the co-pays that we pay and our prescription cost. Last year, I looked it up for the show. Last year, we spent just over $14,000 in premium copay and medications and tests. And there are things we have to turn away. My husband has COPD. There are 2 or 3 tests they like to do every year to make sure that, his lungs are operating at their optimal best. We're able to do one and not the other 2 because we can't afford them. I have some tummy issues. They want me to get this scope done. Well, I don't want to get it done anyway because that doesn't sound like much fun, right? But the other issue to it is that my copay for that is $600 and something.
Right.
I can't afford that.
Right, even with Blue Care Network, when I had to have all of my testing done, they found the spot, they wanted to send me for a PET scan. My insurance company didn't feel that it was necessary for me to have a PET scan, but the doctor did. So if I wanted to have it done, it was $12,000 to have it done. Okay, I just don't have disposable income like that laying around, and I'm certain our families don't have that type of income.
We have, I run into that a lot. I spend hours upon hours. One day I literally spent 6 hours on the phone jumping from one person to another just to get one of my daughter's medication that she had to have because she had a lactose problem and could not eat the food that the school was providing for her. And she was on the free and reduced lunch. So I had to fight for 6 hours with everybody until I got literally to the CEO of the insurance that, because what most people don't know is that with Medicaid, even though you have a plan, they don't always cover everything. There's a small portion of medication that it's funneled through a Magellan is the company. And Magellan makes the decision if these medications are actually necessary. I had to not only get a doctor's note from one doctor, I had to get her case notes for up to 5 years, and then also get a second doctor to say that she needed it. Still fought for 6 hours to get to the CEO before he would approve it.
Oh my goodness.
Now you think about, because that's a pretty serious issue to me. My child gets free and reduced lunches, goes to school, cannot eat those lunches that are provided because she's lactose intolerant unless she has this medication.
Right.
Think about some of our moms. Jamie, you know our moms. Proportionately, how many of our moms would have been able to do what Jamie did
Oh yeah.
to be able to get to that?
A lot of the moms aren't as forceful. Some people call me strong-headed or
Well, yeah,
like
and
a
very
bulldog.
resourceful, and
You know,
a mom who's working, 12-hour days.
Yeah.
Like
And she's
this
got
would
a
be incredibly
30-minute lunch
challenging.
and a 10-minute break. She doesn't have time to sit
and a lot
on the
of these
phone.
insurance companies, they close down by 4 or 5 o'clock in the afternoon, and they don't open up usually till 8, 9 o'clock for anyone to call and talk to anyone. So then she has to make the decision, okay, do I go to work and make income this day, or do I call in sick if I can, so I can spend literally all day on the phone fighting for this one thing? Because I can't afford $30, $40 a month for medication. Even if she scrimps and saves every dime,
Yep.
it's next to impossible for a lot of our low-income women to actually get the health care that's needed.
Well, and the other thing, too, that I think is definitely a hidden cost of health care, my child's sick, but I don't take him to the doctor. And
Right.
some people might say, oh, your child's been sick for 2 weeks. Yeah, but to take my child to the doctor requires me taking a day off work,
Right.
which could result in the loss of my job. Or, a sick child who can't, if you use a daycare center and not like a relative or something, you can't take your child
Right.
to daycare because they have a fever, because they're sick. Now you're forced to stay home with that child. And just even, transportation. Maybe my doctor is Serial City Pediatrics and I live in Post Edition. How am I getting all the way out there? We've had our moms tell us tragedy stories of doctors being very upset with them because the children were behind on immunizations. Well, they should have had this immunization 6 months ago, or this was actually due a year ago. But this particular mom that we were talking to really just does the well visits and doesn't go any other time and doesn't make it there for those things. So, but yet they faulted, which is another thing. This is a really tragic story. I know that you'll remember this one. Please don't mention any names because I did not get her permission to share this story, but I could just share the story vaguely. In 2016, we had a child who died who was 4 years old. And it was a direct result of this same thing, of being marginalized because I'm on Medicaid. So her child had flu-like symptoms, and she had taken them several times. I will not name the provider either because that would not be fair. to a local provider saying, my child is sick, they're lethargic, they're not eating, they're feverish. And she was told, your child has a virus, your child has a flu, we can find nothing else, take the child home. Finally, on the third visit, she was told, look, you're abusing your Medicaid at this point. Like, we can report you for abusing Medicaid because your child has a virus and you're dragging them outside and dragging them here. Nothing more that we can do for them. It didn't feel good to her, so she left that doctor's office and she drove immediately to Kalamazoo and took her son to the emergency room. Tragically, 4 hours after reaching the emergency room, his organs started shutting down, and he passed away the next day.
Right.
Really a tragic story. Now, I don't know all the details to this and all the facts. Just what I spit was what I know. But I often wonder when I think about this mom, what would have happened if that provider would have addressed it a week earlier? If they'd have got to the problem a week earlier. This mom knew her child. She knew he didn't have the flu.
Right.
Like, that's a hidden cost of it too. She's not the only mom that we've heard from that they will say you're abusing your Medicaid. I could think of an adult mom recently, and I won't name her name either because I also didn't get permission to share her story. But she was being seen at a local provider and she had some tummy issues. She was bloating, she had pain, a lot of foods that she couldn't eat. So she's going to this provider, and one of the first tests they do is a gallbladder test, and she passes it, right? Then they run a series of these other tests. They can't find anything wrong. She comes back for a visit to this provider. This is like laughable. And he says, we're going to schedule you for gallbladder surgery. And she says, oh, so my gallbladder is bad. And he says, no, the test showed that it was functioning normally, but sometimes that can happen, and we can't find anything else wrong. So we're just going to take your gallbladder.
You don't really need
And she's
that.
like, okay. So, and this same mom, one of the nights she went to the emergency room, now she doesn't have any support. There is no baby daddy involved. There is no family around this mom. This is it. She could have, of course, called the co-op member, but this was in the middle of the night and she needed to go to the emergency room. She was sick. So she drags these two kids with her. She was chastised so bad for taking these children with her. And it's like, okay, so you're a professional person who understands that you could have got a grandma or a dad or a babysitter or somebody else to sit with these children, but this mom virtually had no one. I think those, for me, are the hidden cost of healthcare, is the trauma in it. And
the stigmatism that you get, because I mean, you go to these doctors, you say, hey, there's something wrong. I did the same thing. I've had issues for quite a while. I kept saying, hey, I'm having this pain. They would say, oh, it's just because of what you're eating. Here, cut this out of your diet. So I would. And then one doctor would say, oh, this is wrong. And then another doctor would check me for it, and oh no, that's not right. That's perfectly normal. Well, they kept on, and the side pain kept getting worse and worse. I ended up violently sick one night. My husband took me to the hospital. Of course, they see me come in. I'm a Medicaid patient. Oh, you probably just have a simple bladder infection or something. But I had one doctor who just for the thrills, I think, decided to do a simple MRI CAT scan on me. And all of a sudden I get rushed in and said, well, you have appendicitis. Here, we're going to take your appendix out. I didn't even have time to say yes or no. And I was wheeled to the emergency room. Thank God they took it out. I had cancer. Nobody in a year and a half of me complaining about my side pain took the fact that I was having pain seriously. I went through so many tests, x-rays, ultrasounds, MRIs. Let's do this blood test. Let's do this blood test. Hey, let's scope you one way or the other. Nobody really wanted to. It was just, here, give her a pill and send her on her way. Thank God they found the cancer early. It was at stage 0, so that means it didn't spread. But the doctor told me if I would have waited even 1 month, the type of cancer I had was like an overfilled balloon. If it would have exploded, I would have been dead in 6 months because it would have literally affected every one of my organs.
Because it would have clustered across.
Yeah, it would have. I would have had cancer of the liver, stomach, colon, everything would have been infected with the cancer, and there would have been no treatment other than keep me comfortable until I passed away.
But do we think this is, guys, do we think this is a provider issue where the providers just aren't doing a good enough job locally? Or do we think that this is really about being marginalized because I'm on Medicaid?
I think it's both.
I think it's both. I mean, okay, just for instance, how many OBGYNs here in Calhoun County accept women with Medicaid right now? Very, very few. So
Yeah.
the women are kind of clustered into doctor's office, a few that do take them. These doctors are seeing 500, 600, 700 women for these, for having babies, women problems. They can't handle that many. So what ends up happening is they are rubber stamped. Okay, you're here, boom, you're gone, boom, you're gone, you're fine, boom, you're gone. Even if somebody comes in and complains, oh, it's in your head, boom, rubber stamp you, and gone. Because these providers are being spread way too thin. We do not have enough providers, pediatrics. We only have a couple pediatrics in Battle Creek right now accepting Medicaid patients.
Yep.
And do we have a pediatric? For a while, we didn't have a pediatric wing at our local
We don't.
hospital.
We still
either.
don't.
We still
You
don't.
No, we don't.
You go to
If
Kalamazoo.
You have to go
And
to
what's the
Kalamazoo.
story behind that? Is it just because we certainly would use it, right? Or is it because we didn't use it? Does anyone know?
I don't know.
Funding. They
Funding.
took the children's wing out of the hospital because they said it was not profitable for them to have it. It was costing them too much money to keep that wing open when they can send all of these children up to their Kalamazoo site and have a wing up there and concentrate their cost. Because it's more profitable to take care of geriatric diseases that can linger for weeks on end, and they can charge for these more than they can for pediatric.
Who thinks hospitals shouldn't be businesses?
Well, we all do. I mean, come on, think about it. We're talking about the health of people. But at the same time, you understand, these doctors go to school, they get into debt, they have to pay back their student loans. I mean, there's doctors in their 60s still paying off student loans. But at the same time, at some point, the reason for healthcare has disappeared, and it's now a business.
Right.
Yeah, I think it used to be different once upon a time.
Once upon a time.
I don't know, but I was really delusional as a child, so it might have not been different at all. I might just not have realized how delusioned I was until I was an adult. But it's definitely something that frustrates me when we work with families to see what's not afforded to them, or even to see, the difference between. So Valerie had good insurance through her husband's employer, and went through a terrible health thing 2 years ago. And same thing, like it was a really quick, oh my gosh, we found something and you have to have surgery right away. And how she was treated and how she was pushed through that system and cared for and okay. And then we had another person who had a really very similar situation, I think, very similar, not the same diagnosis, but very, very similar
Very similar.
situation. And she was not pushed through in that way at all. Like there were all of these I's that had to be dotted and T's that had to be crossed and permissions that had to be granted and asked for and
Oh, yeah.
yeah.
They didn't
It's-
even ask for permission.
Yeah,
They just came in and did what they had to do, like with you. But mine was, they didn't even know it was there. They didn't know what they were doing. I was scheduled for a totally different procedure. It was found prior to. And it was like, oh my goodness, we need to take care of this right away, but let's do this, this, and this first. The other young lady that we dealt with was like, I don't know what to tell you.
Yeah.
The other thing that just irritates me is folks who have chronic pain, who are truly in chronic pain, cannot get the type of help they need or what they need because of the opiate addiction crisis that we have here in America. And I just think that everyone is kind of put in a box because, oh, you have pain and you've come to me 3 times with the same pain. You're a junkie. You
Oh,
just
yeah.
want medicine. You're not addressing that pain issue.
What's the other side of it too? We had a member who was addicted to Vicodin, to codeine.
Yeah.
And the treatment for that was to be put on Suboxone. But then that, to her, she said, I'm just replacing one drug with another.
Right.
And you're supposed to get weaned off of that, but we never saw her being weaned off of that. And the interesting thing to me was we wanted to choose inpatient treatment for her. And what we found out is Medicaid will pay for methadone clinics, they will
Right.
pay for Suboxone, they will pay for all of these things. They'll even pay for you to see a counselor. They won't pay for you to go in treatment.
Nope.
Right,
That doesn't
because
make any
it's too
sense to me.
costly.
Yep.
So
But-
like the average methadone clinic costs about $500 a month. And that's just walking in and out. But if you're inpatient, I think the cost was like $6,000 to $20,000 depending upon the length of your stay and how long you have to be there. So
And again, we're not really trying to slam any
No.
healthcare
No,
out
no.
there or slam any local providers. We
No.
love our local providers. So
We
if you're
do.
watching this, do not hate on Women's Co-op because we are not slamming you. We are not doing that.
No.
We're just simply saying that we think that sometimes, and this is what the show is all about, it's why we bring it. Sometimes we think that people, well-intentioned as much as we are, think, oh, well, they get free insurance, they get Medicaid. No worries. No, there are a lot of attached worries and hidden costs to
Absolutely.
that. Or they say, well, yeah, Jamie's husband's sick and he has cancer, but why the heck doesn't she get a job? Well, because Jamie's husband would die then because he
Yeah.
wouldn't get the medication that's
Right.
saving his life. I mean, we're just really trying to highlight these stories and bring attention to it. We're not really trying to slam anybody locally or make anybody feel bad. We're just hoping that, just like our previous conversation with Alyssa Stewart from United Way, that if we can bring awareness to some of this stuff
Yeah.
and get people talking, the right people,
Right.
we can change things as a community, as a society, because I'm sorry, folks, but what we have right now just really isn't working for people in poverty. It just
Not
really isn't working.
It is not, no.
I mean, like I said, I love my doctor I have now, and I love my kids' doctor right now, but it's a challenge.
It's the hoops.
The insurance company, when Brett had to have IV medicine, told the cancer center, oh, well, she can do it at home. She can put the IV in and give him his IV medicine.
You're
And Jamie was
resourceful.
like, bring it on.
And I literally
New
had
skills.
I had to literally call. I have honestly, to be honest, through this medical necessity that I had to learn, I have learned to do a lot of things. I had to give my husband injections in his stomach. I've learned a lot of medical terminology. I have learned how to do certain things. I can change a person's bed in the hospital better than a nurse can sometimes. So it's really kind of funny.
But think about something for a minute, Jamie. If you had money, if you had means, if you had a good insurance and a good job and you had money, you would have nurses coming to take care of Brett.
Oh, yeah.
To do
I
that
would have
stuff.
probably not had to fight for the treatment that we got for him. They weren't even planning on letting him see an oncologist for 6 months. I basically went to the office every
it up,
single
you said.
day and says, do you have any cancellations? Do you have any openings? Do you have any cancellations? And I sat there all day, and that's all I did for like a week and a half. And they finally said, look, I'll let him come in next week if you'll stop coming into the office.
And again, and we know this by heart because you are a founding member and have been with us since the beginning, but you're relentless in doing that stuff. You're resilient. You're
I took my
relentless in
kids with
doing
me.
it. But
and
there
sat
are a
there.
lot of members who would just give up.
Right.
Because what else are you going to do? Jamie, I want to thank you so much. I don't know why it's taken us 8 episodes to get to a member to be a guest on the show, but I'm glad that we did, and I really appreciate you coming in. I want to thank you for all the stuff that you do for Co-op. There are a lot of people, even newbies, who come in and you say, what do you do? Call Jamie B! Because you're just like the go-to for everything. And I know that you've got a lot of stuff going on with your own family and with Brett, and I appreciate that you've always been there for us, and we're very grateful for that.
Well, you guys are like family to me. I mean,
Awesome.
You're our family as well. And so, lastly, I would like to show you this amazing shirt that I'm wearing. It says, "Find your purpose and live all the way in it," by the famous Dr. Nakia Bayless from United Way. This is our June feature. And we also are featuring
Amelia Earhart.
And then next month in July, we will be featuring Umo Udo out of Minneapolis as our global hero. And
Pastor
Sherston Sullivan. She just recently got married. I really do know our pastor's name. Pastor Sullivan will be featured as our local hero. So be sure to watch out for those. Thank you for joining us again, and have a good evening.